Happy Monday, everyone. I'm Dr. Karen Leong, part of the Face and Body team, and I apologize for missing last week. Got a little bit sick, but now we're back. So we wanted to talk today about the secret of aging eyes. So when we were thinking of topics, I'm like, well, what can we talk about? I really wanted to talk about eyes. And so Chelsea, who's our marketing person, said, why don't we talk about the secret of eyes? And I said, well, what is the secret of eyes? And I've been thinking about it. And, I feel like the secret of eyes is that there's no secret to eyes. I always tell people that it's like the gateway to plastic surgery, because when you're looking in the mirror as you go from your teens to your 20s and so on and so forth through your middle age and into your twilight years, what you notice a lot is your eyes. This is where you start to look tired, either because your eyelids are starting to droop and you feel like you have to work harder with your forehead to keep them open, or you're starting to see shadows and bags under the eyes. Part of this may be hereditary. I see so many patients who say, my dad has this, my mom has this, I look exactly like my mom did, they had to have the surgery. So there are those people. And then there are other people, just with the effects of the California sun and, a lot of golfers and all the squinting that they do, or being out on the water on their sailboats. A lot of changes happen to the eyes. The reason for that is kind of a couple of reasons, but mostly because the eye is such a delicate area. The skin is unlike skin anywhere else on the body. For the same reasons that it makes you age, it also makes working around the eyes really nice as a surgeon, because it's probably the closest thing that we can consider scarless surgery. Now, why do I say that? Because the skin of the eyelids is so fine and thin, and we don't have any hair follicles in the eyelid itself, when we do make incisions there, and even as a process to healing occurs, it tends to heal very well in just about everyone. So even if you say, oh, I'm prone to keloiding, we don't worry about it in the eyelids. And then for Dr. Park and me, a lot of the times we do our lower eyelids with incision on the inside of the eyelid, kind of there along the conjunctiva, so that it really is scarless because there are no incisions on the outside of the eye. Now, when I see someone who comes in and says, my eyes look really tired, what can be done? I've had friends who've had eyelid surgery. I'm nervous XYZ, or I'm excited XYZ, or I have XYZ expectations. And we kind of do our analysis, again, kind of like my previous video, from the top of the head down to the neck here, because even though the eyes seem like a very specific request, a lot of times it ties in with the position of the eyebrows and also how much your cheek and mid-face have fallen, as these can all affect these things. So using myself as an example again, when I look at someone, I kind of take a look at their forehead and their eyebrows. I'm looking to see, when you look at me and you're talking, am I noticing that you have wrinkles in your forehead, or that your eyebrows are always lifted like this in order for you to look me in the eye? We then block your forehead. I tell you to close your eyes, and I kind of hold your forehead in a neutral position and have you open your eyes. And if you're doing this, when I have you open your eyes, then, for me, I know that part of the reason why you're feeling like your eyelids are so heavy is because your eyebrows are positioned too low, in which case we might have to talk about a combination of doing a brow lift with the upper eyelids. In other people, I'm looking at their eyes and I have you close and do a very similar look up, look down, just to take a look at where your eyelid position is compared to your pupils, and that can tell me whether or not you have a droopy eyelid, which is called ptosis. And this is a kind of a different anatomic issue, which happens for different reasons: trauma, congenital, aging, wearing contacts will do it. But this is something that would also need to be repaired, possibly in conjunction with or in addition to the upper eyelid surgery. But say you're a typical patient, your eyebrows are good, you don't have any drooping of the eyelids themselves, and you just have overhanging skin that's really heavy, and if you pull it out, it doesn't really snap back. You find that when you try to put your makeup on in the morning, you're basically peeling your eyelid skin up just so you can see the crease, and as soon as you put your mascara on, you say, ugh, there it goes again, because it just smears all over the place, it gets stuck in the creases, and you say, forget it. Something's got to be done. So for someone like you, we have a very straightforward upper blepharoplasty. Dr. Park and I do ours a little bit differently, but the general idea is we're taking that extra skin that you have, that you hate, and we're removing it. What I love about doing eyelids is I can do them under local. You and I can chat about the weather or sing along to the radio and numb you up, and we're done in 30 minutes. Take the skin, depending on how much fullness you have, we go chasing after fat. So a lot of people will say, hey, I've got this really bulge thing here. Can you take care of that? Yes, absolutely. This is a very common area for people to have prolapsed fat. And talk about fat because when you think about the eye, I always say it's kind of like a butthole. You have a muscle around it, so around the lips too. So see how I have lines around my lips? The same idea. When I squint, I get that around the eyes, and as we age and everything weakens, what used to be held and contained in good position behind it now starts to push its way forward, and we see that usually as fat here in the inner corner of the eye. Some people have it kind of all throughout, and depending on your needs and what you look like when you're younger and what you're trying to achieve, we kind of tailor it to what will result in the best way. So in terms of recovery for upper eyelids, we have one line of stitches right in your crease. We determine where the crease goes, and they stay in for about a week. We have you just keep a little Aquaphor ointment on it to keep any dried blood from sticking in that area, but you can otherwise wash your face that you normally would and pat dry. I do recommend that you keep away from wearing contacts for about a week after upper eyelids, just to let everything heal and the stitches to be out, so you don't always touch your upper eyelid. And once the stitches are out, say give it a day or two to rest, and you could put your makeup on. And most people are out within the week having dinner with friends and family who say, wow, your eyes look good. Did you? But they can't really tell. And with time, those that scar fades away to nothing. It's kind of a thing of beauty. If we're talking about lower eyelids, see a lot of people, and I'm starting to get it, with tear trough deformity, where you have this line, this crease here, it looks really hollow, and then you have a big poofy bag or dark circles under the eye. And again, the same idea as with the upper, that muscle that's a ring around the eye gets weak, and those little poofs of fat tend to push out. Notice this usually worse in the morning, because as we're sleeping, all that edema fluid that normally drains off during the day just sits around the eye, and because that skin is so thin, it tends to poof out right there. So for this procedure, for people who need this, again, we're making an incision on the inside of the eyelid there. Again, with numbing eye drops in the eye and something make you a little bit sleepy, but you're still awake and listening to us. Go in there and tease out the fat. There are 3 fat pads around the eyes, and we kind of determine beforehand how much needs to be taken out, and we do it conservatively because we don't want to overdo it and cause you to look hollow, because it's hard to correct something once you've overdone it. And once that's done, we redrape everything, and voila, you have smoother eyelids. However, that does not necessarily correct the tear trough, and it doesn't improve the crepiness underneath the eyes. For that, Dr. Park and I really like to pair either a TCA, which is a medium depth peel, chemical peel, or our CO2 laser, which can resurface and tighten the skin underneath. So I always think of it kind of like a shrink wrap effect, a little frosting on top, just to polish off the effect, because who wants to have the bags gone but still have loose, wrinkly skin underneath? Not me, not you. And some people, fat's not really the issue, it's really just the extra skin. In those, then I might do something called a pinch blepharoplasty, which means that I'm taking a pinch of that skin. In this case, there is a very faint incision right under the lash line, but again, because of this beautifully magical skin underneath the eyes, that tends to disappear away to come just about nothing. Stitches stay in for about a week again. And I just warn people that if you have a history of dry eyes, that your eyes may be drier than usual for up to several months after surgery, and I encourage everyone to use eye drops and eye ointment. And recovery for the lower eyelids is very similar to uppers, about a week. Sometimes the swelling will last longer, and after the peel or the laser, you are a little bit pink. So for those, I do tell people that, you know, you may have to wait a little bit longer just for the swelling. Most people won't be able to notice that you had anything done, but when you look in the mirror, you probably will notice. Lastly, I always do tell people that just because you have eyelid surgery doesn't mean that it's going to take care of everything around the eyes. These are all static issues. For more dynamic issues, like the crow's feet that you form, or still these tear trough deformities, we may still have to do some neurotoxin like Botox, or a little bit of filler, or, you know, we may talk about fat transposition if you have a really deep hollow. But those are kind of the more particular cases. Most people who come to us are pretty standard, pretty straightforward, and they have a very good experience with the surgery and a very good outcome. So just to wrap it up briefly again, we look at the brow position, we look at how much is hanging over the eye and the position of the eyelid compared to your pupil to determine whether or not you need a brow lift versus an eyelid lift versus a correction of the droopy eyelid or ptosis. And for the lower eyelid, we look at how much fat you have when you're looking down and looking up, how deep the hollow is for your tear trough here, and how the quality of your skin is, if it's crepey, if it's dry, if it looks like it's had some sun damage. And we put together a comprehensive plan for you, and these can all be done at the same time. Again, we say eyelid surgery, the secret to it is that there is no secret, except that this is a great entryway. You get a very good result very quickly, and the healing time, the recovery time is also very quick. And it's the closest thing to scarless surgery that we can offer in our plastic surgery world. So if this is something that interests you, please give us a call. Happy to come and talk to you and meet with you and answer all your questions. In the meantime, this is November, and we're going to continue with our head and neck, our face series, including skincare and lasers. So if there is anything that you're interested in, please do shoot us a message, or leave us a little note on our Facebook or Instagram, and be more than happy to address it. Other than that, Thanksgiving is coming up. We're going to keep doing these probably next Monday, so keep tuned in for the next topic. All right, thank you. See you guys. Have a great week.